This video is to describe to you how to perform CPR on a child. The definition of a child is going to be 1 year of age until puberty. And so if you see that a young boy is developing chest hair, armpit hair, then they will be going through puberty. And or for girls, if they are developing breasts, then they would be going to puberty. So we want the 1 year old through till right before puberty, and that would be considered a child. In this particular case, I guess you could describe two types of kids. There would be the smaller, younger child, which is very tiny, unlike this model. And you would have an older child who could very well be the size of an adult or pretty close to the size of an adult. We're going to pretend that I have a junior-sized person because obviously this doesn't look anything like a 2-year-old or a 3-year-old as an example, but the idea behind what we need to do is all the same. So you're still going to check the scene for safety. If you are feeling that it's safe, then proceed to help them. Next, you're going to do the "Are you okay?" In the case of a child, you would tap the shoulders and "Are you okay? Are you okay?" And then you look and scream for help. Somebody help me, please help me. The next thing that we're going to do is we're going to scan the lungs and the chest to see if it rises and falls. For the child, there's two locations that you could check. It would be the brachial artery, like we did in the neck. Start at the trachea, slide your fingers down the side of the neck until you get to the groove, and that would be the brachial artery. The other is called femoral, and that is in the hips. So in the groin area between the hip bone and the pubic bone, you have a spot, a groove, and you can feel a pulse. That is a very effective location for a child, especially 1 through about 10 or 12 years of age. So either the carotid or the femoral artery in the hip on the top. From there, if we are feeling for a pulse and we're looking for breathing, if we do not feel a pulse and we do not see the chest rising, then we are screaming for someone, pointing to someone, please go call 911 and get the AED and bring it back. For a child, we are going to be pressing almost 2 inches into the chest with the compression rate of 100 to 120 compressions per minute, very similar to an adult. And you're going to have a 30 compression to 2 breaths. The key here is that for an infant, we were using 2 fingers. For a small child, we are going to be using 1 hand. Now, for a larger child, you might do the grip with the hand on the wrist, or if that child is almost as big as an adult, you might have to use 2 hands. But I'm going to assume that this is a smaller child, so I'm going to use the heel of my dominant hand. So I'm going to press that heel right in the middle of that sternum, right just slightly below the nipple line. And with good alignment, getting close, to, bringing your knees close to the victim so that your shoulder, elbow, and wrist are over the top. And I'm going to do 30 compressions and 2. So I would just go 1, 2, 3, 4. So you are using your shoulder and your body to push down almost 2 inches into that chest. And the head tilt, chin lift is almost identical to the adult, except if they are a smaller child, you're not going to have to tilt the head. But because their facial features are tiny, you may end up on a small young child, you may end up almost putting your nose on top of your mouth, on top of their mouth and nose. So we would do 30 compressions and then gentle head tilt. For a smaller child, you're not going to exhale into their mouth as you would a child that is larger or taller or bigger or older. So it's going to be the one heel on the sternum, watch your alignment straight down, and you're going to be pressing. For the child, the 2 breaths are just as important as the infant. We need to get oxygenation, the circulation going through. So make sure that you do that. And that is how we do our child. So here is going to be one full round. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. And that's one round. Thank you.